Advisory Committee. I would first of all like to turn to Marcin to make an announcement.
Thank you, Mr. Chair. This meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live-streamed on the Access Health CTE website. Thank you, Mr. Chair.
Okay, and please, everybody, if you could announce yourself before you speak so we know who's talking. With that in mind, I'm Grant Ritter, the chair of the committee, and could we have a roll call?
Thank you, Mr. Chair. Grant Ritter, Chair.
Yes.
Got it. Sean King.
Here.
Mark Schaefer.
Here.
Matthew Brockman. Manisha Zutani. June Goen.
I'm on.
Thank you. John Vercola.
Here.
Thank you. And Tricia DeVay.
Here.
Subject matter expert from Connecticut Insurance Department. Thank you. We do have a quorum, Mr. Chair.
Yeah. Okay. Would we like senior leadership team to introduce themselves?
Good afternoon, all. James Michelle, Access Health Connecticut.
Yes.
Good afternoon, Susan Rich By, Access Health Connecticut.
And Kelly?
Kelly Cody, Access Health Connecticut.
Anyone else? Okay. Do we have any public comment?
Mr. Chair, no, we did not receive any public comments
No
today.
public comment. Okay. Wow.
So we're going to move over to the minutes.
The minutes. Could I have a motion from a member to approve the minutes from last meeting, which was April 1st, just 8 days ago? Somebody that was there?
This is
Thank
Sean.
you.
So moved.
Yep. Seconded?
Second.
This is John.
This
Second.
is two.
Two. Okay. Fine. Thank you. Any comments, edits, changes? If not, can we have a vote on approving the minutes from last meeting?
Grant Ritter.
Yes.
Sean King.
Yes.
Mark Schaefer.
Yes.
Matthew Brockman. June Goen.
Yes.
Manisha Zutani. And John Vercola.
Yes.
Thank you. Motion passes.
Okay, great. Thanks, everyone. So next up, let's turn it over to Kelly.
I'm not going to go through the slide, but this is just the updated slide as requested. It has been updated so that each year has the same level grids, so that's an easier comparison. So if there aren't any questions, we can really get into the crux of the conversation with
Today's meeting.
Yes.
Certainly a lot of similarity between the years, but a small change. Yeah, thank you. Okay, then now the real reason for the meeting today. Let's have Ren go through the various plan designs that we haven't approved yet, and hopefully come to some conclusion because we have a board meeting coming up.
Yes, good afternoon, everyone. We just jump into silver plan. So it's everything is the same. All I did was I add the last row, which is the premium impact from option 1. Since the carriers don't even have a silver premium by like standard plan and by variation, so I use Wakely's cost model. Just did a rough estimate for comparison purpose only. It might vary from the actual carrier's premium impact, but just for your information, the option 4 is tentatively chosen. Last time, it's more of a balanced modification from 2026 plan, slightly increased the deductible and co-pays. So I think the committee preferred this one. Based on my estimate, it's about $13 more than option 1, a little cheaper than option 3. I removed option 2 because it's not compliant for AV. So we have 3 plans to choose from. And so far, option 4 was the winner based on our last discussion.
Okay, does anybody have a comment to make about this? Would you want to reconsider this, or is option 4 seems to still seem to be the best the best way to go? The $13, by the way, as you said, does not impact a lot of people because they get the tax credit, but it does impact anybody that's trying to pay for this out of their own pocket, I suppose. The
I
people
still
who
sup-
are,
I'm sorry, Grant,
Yeah.
I didn't mean to interrupt. I was just
Go
gonna
right
respond
ahead.
to your question that I continue to support option 4.
Great, thank you. That's I do too, actually. Um, well, if there's no other comment, let's move on to the other ones.
Yeah, next slide, please. Yeah, so this one for 73, that's the only option we have because it has to be 2% higher than the base silver. So if we choose option 4 for a silver base plan, and this option 2 is the only option for 73 variant.
Excellent. I see that there's no premium. This is getting a somewhat of a tax benefit. Um,
Mhm.
how does this differ in tax benefit from the 70%, the basic silver? Oh,
Yeah,
the income has to be the income level is like what, 250?
It's
Yeah.
just 200 to 250 grant for this one, or over
Got it.
200 to 250 for
Over
this
200
one.
to 250. Okay. And obviously they get a slightly higher AV value. Okay. Fine. Everybody okay with this? It's the only one available, and it was preliminarily approved last time, but a little more detail here. Okay, let's move on to 87%.
Yeah, so 87 is actually the one of the easy ones. We only slightly increased the out-of-pocket maximum and slightly increased the lab services. So this is one of the plans that have least modification to be compliant.
Yeah. Thank you. Everybody seemed to be pretty on board with this one from before. Okay, so
I'm comfortable with it though, Grant. I
Yeah.
did have a question. Can you remind us why this one required such minor changes in order to be compliant compared to some of the others?
probably because the AV value from previous was not so out of alignment, I guess. I guess there's a 1% de minimis, and we were at 88.6. So all we had to do was lower the 88.6 down to less than 88. Sometimes
Yes,
we were like
exactly. Yeah.
Yeah, sometimes you were 2% out of alignment, and we had to make a bigger change to get ourselves down.
Yep. Thank you.
Yeah. Okay, let's move on to 94%.
So there,
You have a
yeah.
choice here.
Yeah, two options for 94. I think last time the committee preferred to keep the copays unchanged. So that's why option 1 is more of a preferred version. So simply because, yeah, people probably want to keep copay the same. They don't want to see the increase in copays.
Okay, and right, the increase in copay, the premium does go up by $2. I sort of see that. That's
Yeah.
kind of overwritten some other note, but
Yeah.
even $2 for a person in this might be a deterrent. But
Just
yeah, we liked option one last time because of the copays. We thought the copays are more important to keep them limited and raise the out of pocket a little bit more. And I
and excuse me.
go ahead. Yeah.
Oh, sorry, Grant. I was just gonna comment when you were talking about the premium. Anyone who would be eligible for the 94% plan and choosing that would be in covered Connecticut at that income. So they wouldn't be paying the difference
Oh, okay.
in premium.
Okay, so the 2% is for the people in the higher income brackets. So they would get it paid. I'm sorry. They would be covered by Covered Connecticut, and the Covered Connecticut would pay the $2 increase, right?
Correct.
Yeah. Okay. Good point. All right. We got this. Okay. I think option one. Does anybody have any issues? We basically talked about the trade-off between copays and higher out of pocket last time, and it is a poor choice, but we have to make it. Okay,
No issues.
let's move. Yeah, let's move on. The bronze.
Yes, the bronze plan, yeah, there's option 1 and 2. The major difference is the option 2 has the specialist care. Deductible does not apply. I think that was one of the reasons the committee preferred option 2 during our last discussion. And I also added the last row for the premium impact from option 1. Because we respect issuers' confidentiality on their pricing, so all I need listed here is an upper bound of a range of their potential impact on premium. So this one from option 2, compare option 2 and 1, you may see a premium decrease up to $35 per member per month.
Okay. Yeah, this one is bronze plans are popular for as we saw in the initial slide from Kelly. Bronze plans can be popular with the younger people, right? That think that they are probably not going to use it at all anyways, but it's just a precaution in case they have some motorcycle accident or something. So the decrease in premium might matter. Good. Any other comments? Any objections to option 2? No. Well, thank you for the extra information here. Let's move on to the next the HSA one, or the light one and the HSA one. Yeah.
Yeah, so we already approved the HSA
Okay,
plan.
good. Yeah.
Yeah, we look at the light and my apologies. The last slide exhibit we have the 50% after deductible for certain categories, and after revisit the initial presentation, I think it should be 50% coinsurance for all service categories. So I think last time the committee preferred light option 1 with 20% deductible. For similar reasons, I list the premium impact. So we compare this new plans with high deductible, the HSA plan, and the catastrophic plans. So the last 2 rows, if you look at premium PMPM impact from the HDHP option 1, if the bronze light option 1, you will see $90 savings. And for option 2, you can see up to $110 savings. Basically, between option 1 and 2 is about $20 to $30 difference in premiums. So if we compare with the catastrophic plans, you can move from like a 30-year-old move from a catastrophic plan because it aged out to this bronze light one. It may increase up to $280. And if it's option 2, it's $260. So it depends on which catastrophic plans they are in right now. The price differences can vary significantly among carriers. So just for your information, I think bronze 1 and 2, it's about, again, $20 to $30 difference between the two options.
I see. I think it was Susan. Could you remind us who we really targeted with this light plan? I think you
Sure.
talked about it before.
Yep, and there are changes, as you know, that started in 2026 that made all bronze and catastrophic plans on the individual exchange HSA compatible. So that is an option for folks that, are able to do that or are willing to put, some pre-tax dollars there. But also the benefit of having this kind of plan at the bronze tier is that if they are eligible for APTCs, they can use those for a bronze plan. They cannot use it for catastrophic. So this gives people an option who might be, up to 400% of the FPL to be getting that, lighter plan, but actually get some federal financial assistance to help pay the premium as well.
Excellent. Yeah, that makes perfect sense because I couldn't understand why they pay $280 if they, the catastrophic plan isn't that much different. But certainly, if they could use the tax cut, the premiums benefit
Right.
to pay for it, it's a winner. So yes, excellent.
I'd also like to just remind the group as well, we don't have this plan currently in place. So if it is decided and voted on with this group to add the light option, that would be a third standard bronze plan as part of the suite of standard plans
Choices.
from Access Health. Yes.
Yeah. Okay. Well, last time we also sort of liked the 20% better than the 50%, and I continue to think that's the way we want to go. Any objections? Good. And we really have only one plan for the one design for the catastrophic plan. Is that right? And it's there.
It's not
showing
a
us.
standard. Yeah, we don't
Oh,
have
it's
a
not a
standard.
standard plan. Okay.
Yeah,
Yes.
we don't have a
Okay.
standard plan at catastrophic.
Yeah.
But
Well,
I think what Ren used in here is what the carriers have been offering for 2026. Yeah.
got it. Great. Now we've gone through all the tiers, the metal tiers. Do we want to have a vote, or do we want to move on to the dental and then have a vote? What's the better agenda?
Whatever the committee prefers.
Yeah, maybe I think that maybe a vote might be appropriate at this point.
Okay, let's have
At
a
least,
vote on all these plans. Okay. You want to go through them one by one? Is that the preferred way to do it?
Mr. Chair, yes, for the silver, it's going to be one vote, and for the CSR
Okay.
variants,
Okay.
yes.
So each
Okay.
metal. Okay.
Mhm.
So could I have a motion to accept the silver plans? All 1, 2, 3, 4 of them.
Option 4, right, Mr. Chair?
Well, this would be option 4 for the. I'm sorry. Do we do each one individually, or do we do them all?
Yeah, we do each one of them individually.
Individually. Okay.
Mhm,
All right.
mhm.
So could I? This is going to take a little while. Could I have a motion for option 4 of the silver plan, the regular silver plan?
So moved.
Thanks. Seconded.
Second, Sean.
Okay.
Okay.
Any other comment? If not, can I have a roll call?
And I'm just, Mr. Chair, I'm just going to read out the motion. So,
Okay.
Chair Reco requests a motion to recommend that the Board of Directors approve option 4, presented by Wakely Consulting on behalf of Exchange staff as a standard silver plan for plan year 2027. So, motion was made, it was seconded. Any discussion on the motion? None. And Mr. Chair, would you like me to continue with the
Read the
roll call vote?
Yes. You
Okay.
Take the vote.
Okay. Ground Ritter,
Yes.
Sean King,
Yes.
Mark Schaefer,
Yes.
Matthew Brockman, Toon Goen,
Yes.
Manish Sutani, and John Verkula.
Yes.
Thank you. Motion passes. And Mr. Chair, now we're going to be voting on the CSR variance for 73%, 87%, and 94% in one vote.
One vote. Okay. So just let's spend 1 second here looking at 73 plan, option 2, and then on the 87 plan, can we move to that? I think it's option. Oh, it's option. Oh, we already approved that one. Good. No, we didn't. Okay, option
Preliminary.
1. Yeah, a preliminary. Yeah. Option 1 on the silver plan. And then finally on the 94 plan, it's option 1 again. Okay, so those are the 3 designs that we're voting on. Could I have a motion to accept those 3 plans?
So, Mr. Chair, I'm going to read out the motion again.
Okay.
Chair Obrero requests a motion to recommend that the Board of Directors approve silver 73% option 2, silver 87% option 1, and silver 94% option 1, as presented by Wakely Consulting on behalf of Exchange staff as the standard silver plan variance for the 73%, 87%, and 94% CSR plans for plan year 2027.
Great. Could I have a
So
motion
moved.
to accept?
So moved, Sean.
Thanks, Sean. Seconded?
Seconded.
Thank you. Any discussion? Any further discussion? Could we have the vote then?
Graham Ritter,
Yes.
Sean King,
Yes.
Mark Schaefer,
Yes.
Matthew Brockman, John Goen,
Yes.
Manish Jutani, and John Verkula.
Yes.
Thank you. Motion passes.
Great. Okay, the bronze plans. Let's look through the bronze plans that we haven't approved yet. First, the so-called non-HSA bronze plan, option 2. And then moving to the light plan, option 1. We don't need to vote on the HDHP plan. Okay. Okay, option 1 on the light plan. Those are the 2 that we have to vote on. So, Marcin, would you like to read off the motion?
Yes, so there will be 2 separate votes. Chair Rader requests a motion to recommend that the Board of Directors approve option 2, presented by Wakely Consulting on behalf of Exchange staff as the standard bronze plan for plan year 2027. Their motion?
Is there a motion to approve?
So moved.
So moved, Sean.
Thank you. Okay, seconded?
Seconded, Mark. If
Mark?
you put Sean as first.
Yeah, okay. Discussion. Great. Let's have the vote on this then.
Graham Ritter,
Yes.
Sean King,
Yes.
Mark Schaefer,
Yes.
Matthew Brockman, Tun Goen,
Yes.
Manish Jutani, and John Verkula.
Yes.
Thank you. On the next
Thank
vote,
you.
for the wording, I would defer to Susan Ridgeby.
Okay. Could we have
I'm sorry, what was
the
the
wording
question
on
on
the
the
motion
wording?
for the light plan?
Oh, we didn't have that in there,
No,
Martin?
no, we did not.
Okay, well, it would be to recommend to the board that we add a new bronze option called the bronze light. And it is option 1, right? Is that what no, am I looking at the
Yes.
wrong thing? Yes,
That's
it
it,
is
option
option
one.
1. And to recommend option 1 as the new bronze light plan option for 2027.
Thank you, Susan.
Could we have a motion to accept that, to make that plan?
So moved.
Thank you. Seconded,
Second, Sean.
Sean. Okay, any discussion on this? Okay, if not, can we have a vote on this?
Graham Ritter,
Yes.
Sean King,
Yes.
Mark Schaefer,
Yes.
Matthew Brackman, John Goen,
Yes.
Manish Jutani, and John Verkla.
Yes.
Thank you. Motion passes.
Great. Okay. Thanks, everyone. I think we've done our done our job for this year. Okay. Well, we got yes. We got the demo plans to do now. Okay. So Kelly, do you have a comment before we do the dental plans?
At this point, no.
Oh,
Again,
okay. I guess
the option 1 and 2 were just thrown out there to provide some choices. But it sounded like the group was interested in the original plan. So other than that, no comments.
okay. Could I have a motion to recommend then to the board of directors that we approve the existing plan for the going forward into year 2027? The same plan design. We want to look at it a little further before they decide.
Did we ask for other
A motion,
information,
yeah.
like costs or anything like that last time?
We did talk about cost a little bit, how much it was this year. How I don't know if we talked about.
Yeah, maybe Kelly, can you give a recap on these? I know we talked about possibly in increasing the maximum out of pocket from 350 to 700, 350, 700 to 450, 900.
Right.
I know we discussed that. Can you give a recap what the impact would be?
Yes. So,
Okay.
yeah, in the previous discussion, there was a slide that we talked about rates, and hence the reason why we put option 1 and 2 out there. But after receiving information from both issuers, the out-of-pocket maximum, which only impacts the pediatric benefit, if we were to increase it to the maximum amount, which is listed there at the 450, 900 from the 350, 700, which is currently in place, it would have a very minimal impact to the overall rate. And I believe on average, it was about $1 per member per month. Again, it only impacts the pediatric side of the benefit. The other changes on the diagnostic and preventive services and the basic services, those both did not provide a large decrease in rates, depending on if it was the pediatric benefit. And I'm going by memory, but I believe it was less than $10. And from the adult benefit, which is age 26 or above, I think it had a less of an impact of, like, I think it was less than $6 per member per month. So it wasn't overall, it wasn't very impactful. And so I think that's where we kind of like left it. I think there wasn't additional information requested because of that information I provided. And I think that's where we fell with, it sounded like the committee was more interested in focusing on keeping the current plan in place for 2027.
Thank you. Yes. And we're talking about $50 to $60 to begin with, and then it's going to go up, obviously, but that's pretty much where we are now.
Correct.
Well,
For
actually,
this-
there's three different levels. There's the basic, the major, and the medically necessary. But
Right.
as I recall, we were a little more expensive than maybe some other plans, but they were in the $60 range.
Yes, the standard plan is the most expensive plan, but it is a full coverage plan. It has far richer benefits than the other full benefit plans that are out there.
Got it. Okay, with that extra information, knowing that it's only $1 increase or $1 savings if we did raise the out-of-pocket on the pediatric side. Could I now have a motion to just accept the current plan design moving forward into 2027?
I'll make that motion.
Okay, thank you.
Seconded. This is Mark.
Okay, thanks. We do want to offer a standalone dental plan. It's just good to have it out there. It does have some uptake, so obviously there is a group that want it. Any discussion? If not, could we have a vote?
Groundrider,
Yes.
Sean King,
Yes.
Mark Schaefer,
Yes.
Matthew Brackman, Tun Goin,
Yes.
Manisha Tutani, and John Verkula.
Yes.
Thank you. Motion passes.
Good. Thank you very much. Okay, well, we have succeeded in our mission. So now we have recommendations to the board of directors who will be meeting very soon, next week maybe, to take our suggestions and hopefully accept them. So, could I have a motion to adjourn?
So moved. Mark.
Thank you. Seconded?
Second, Sean.
Okay, Sean. Roll call?
Groundrider,
Yes.
Sean King,
Yes.
Mark Schaefer,
Yes.
Matthew Brackman, Tun Goin,
Yes.
Manisha Tutani, and John Verkula.
Yes.
Thank you.
Thank you so much, everyone.
Thank you, everyone.
Thank
you
you,
all very
everybody.
much.
you.
Appreciate
Bye.
it.
Thank you.
Bye-bye.
Bye-bye.
Bye now.